Why do doctors seem so disappointed when you refuse to have a student in the room during your appointment? 3. Be glad you were asked. I was 16 with a massive pelvic infection from a poorly placed IUD that the doctor ignored as I hemorrhaged massively for months. I was taken to a hospital and placed on 4 antibiotics. About day 3, 2 doctors came in with an easy dozen young guys, students, to observe my pelvic exam. No asking, no warning. I still don't trust any doctor. 4. I don't think I have ever refused. I got over it when I had my hysterectomy. Post-surgery, I was in the hospital for a couple days. The doctors would bring groups of students and residents with them on their rounds. They all looked 25 years old and were good-looking, women and men alike. They all smiled, asked me questions, and every single one examined the incision site. They were all fascinated by my urine output and had to closely inspect my urine bag. The first time, I was embarrassed. After that, I stopped caring. On a different note, some people should not become doctors. I had a psych appointment once. My doctor had a med student there doing her psych rotation. The doctor asked me to describe my mental state and how everything was going, which I did. It took about 10 minutes of me talking. I noticed that the med student was on her cell phone the entire time. When I finished, the med student sighed loudly and said I just cleaned up about 200 emails. I mean, WTF? How unprofessional can you get? And no, I will not accept that she was multitasking bullshit. She was going to become a physician. They need to give their full, undivided attention to their patients. 5. When I was 19, back in the mid-70s, I went to the emergency room of a Catholic teaching hospital with extreme pain in my abdomen. The attending doctor did all sorts of exams, including a pelvic exam, and told me it wasn't my appendix, it was cysts on my ovaries and it was a normal occurrence. And he left. About 10 minutes later he walked back in with 5-6 students who needed experience doing pelvic exams. I was not asked. I was told this was going to happen. These male doctors lined up with gloved hands and proceeded to take turns examining me. Some went back in to experience observations made by other students that they may have missed. I was mortified as I was constantly told to spread my legs wider and relax. This was difficult as I was in extreme pain. I was finally taken to surgery where my appendix burst as it was being removed. The exams were unnecessary.